A one-day orientation program on gender and human rights and tuberculosis for media practitioners from Anambra and Ebonyi State has ended in Enugu with a call on the media to champion public education on tuberculosis control, organized by the Grassroots Development and Empowerment Foundation in collaboration with the Center for Development and Reproductive Health under the auspices of the Stop TB Partnership Challenge Facility for Civil Society. The program drew journalists, on-air personalities, bloggers, and content creators representing various media outfits in Anambra and Ebonyi State. We have details from our studio.
In his welcome speech, the Executive Director, Grassroots Development and Empowerment Foundation, Mr. Patrick Ama, said the project is aimed at involving more women and girls who easily fall victims of gender and human rights related issues in tuberculosis control with the help of the print, electronic and social media in educating and enlightening the public. He revealed that tuberculosis is the third leading cause of death among women of reproductive age, while research has it that women are greatly affected by stigma and discrimination within the family, healthcare facilities, and the communities.
We want to reverse it and include women and get them involved. One, they are more in number. Two, they talk a lot. People will hear them more than they hear men. So these factors is you have to be conscious of wherever you are, because TB is an airborne disease.
While providing an in-depth training on the Gender and Human Rights Training Manual for Tuberculosis Programs, the Executive Director, Center for Development and Reproductive Health, Dr. Isaac Olobu, outlined factors making women vulnerable to tuberculosis, including poverty, poor nutrition, low socio-economic status, living with HIV, delayed care seeking, and fear of being disengaged from their employment if they have tuberculosis, among others. Dr. Olobu urged the participants to communicate to the public the contagious nature of tuberculosis, which is also curable, emphasizing the role of overcrowding, poor ventilation, and inadequate coughing hygiene in heat spread.
The more you stigmatize people against a particular disease, the more reluctant those who are suffering from it will feel coming out for treatment. So people should know that continuous stigmatization is not doing anybody good, both themselves who are stigmatizing and the entire public.
Expressing gratitude on behalf of the participants, Mr. Jacob Ogodo and Mrs. Ifeyinwa Onachukwu of the Anambra Broadcasting Service pledged to leverage their professionalism to disseminate insight gained from the workshop.
It is my prayer that the organizers will continue to engage us. I want to promise that we'll use the knowledge we have gathered here to advance the cause of healthcare in Nigeria.
Group work section, development of an operational communication work plan by the journalists on gender and human rights tuberculosis program were some of the highlights of the event.